In bradycardia, heart rate is slower than normal. A normal resting heart rate for most people is between 60 and 100 beats per minute, BPM. Athletic and elderly people often have a heart rate slower than 60 BPM when they are sitting or lying down, and a heart rate less than 60 BPM is common for many people during sleep. To understand bradycardia, it helps to understand the heart's electrical system, which is what makes the heart beat. Your heart has a natural pacemaker called the sinus node SA node, which is made of a small bunch of special cells. Impulses start at the SA node and move through the walls, in the upper chambers of your heart atria. The impulses cause the atria to contract and push blood into the lower chambers of your heart ventricles. Next, the impulse travels down an electrical pathway to the AV node. The AV node is in the center of your heart, in between the atria and ventricles. The AV node acts like a gate that slows the electrical signal before it moves into the ventricles. The final part of your heartbeat happens when the electricity moves through a pathway of fibers in the ventricles called His-Purkinje network. This causes the ventricles to contract and force blood out of the heart to the lungs and body. This cycle is repeated every time your heart beats. Some causes that lead to bradycardia are heart attack, stroke, electrolyte imbalance, hypothyroidism, and congestive cardiomyopathy. Signs and symptoms are chest pain, loss of consciousness, shortness of breath, cyanosis, dizziness, and getting confused. How is bradycardia diagnosed? Your doctor will feel your pulse to get your heart rate and will use tests to get more information about your heart rate and rhythm. A simple EKG can show the rhythm that is causing the slow heart rate, but you may need to wear an ambulatory monitor. The monitor is used to keep track of your heart rate and rhythm over a longer period of time. What treatments are available for patients with bradycardia? If you have bradycardia but do not have any symptoms, or if the bradycardia doesn't happen often or last long, you may not need treatment. But if you have an electrical problem in your heart, you will need a pacemaker to keep your heart beating as it should. A pacemaker is a small device that is placed under your skin to monitor your heart's rate and rhythm. If needed, the pacemaker will send an electrical impulse to your heart to restore a normal heart rate. There are many types of pacemakers. Your doctor will choose the right type to meet your needs. Thanks for watching. Don't forget to subscribe.